Hello, I'm Dr. Laurence Sperling. I'm the Chief Medical Officer for the Family Heart Foundation. Today is our fourth annual Lipoprotein(a) Awareness Day. The Family Heart Foundation established this day to help raise awareness of lipoprotein(a) or Lp(a), which is a very important risk factor for heart disease and stroke. Today's discussion will dive into the current and future state of Lp(a) and discuss the importance of screening for elevated Lp(a), which is a lot more common than we recognize. I'm pleased and very fortunate to have my friend and colleague, Dr. Seth Baum, joining me for this important conversation, Lp(a) Awareness Day. Dr. Baum is chairman of the board of the Family Heart Foundation. He's a distinguished preventive cardiologist, and he's a past president of the American Society for Preventive Cardiology. So, Dr. Baum, thank you so much for joining me and our listeners today.
It's great to be here with you, Larry. I look forward to this discussion.
So it is Lp(a) Awareness Day, so let's get aware. What is Lp(a) and why should we, all of us, want to know our Lp(a) level?
So Lp(a) is a lipoprotein particle. So it's like LDL, low density lipoprotein, but it's in some ways even worse. So we call it a triple threat. It's like a small LDL particle that has three major issues associated with it. One, it causes plaque formation. Two, it causes inflammation. We all know that inflammation is playing a major role in heart disease. And three, it causes thrombosis or clotting, also a very important participant in heart attacks and strokes. So, this is what Lp(a) is. It travels around our bloodstream. It gets into our blood vessels, into the arteries that feed our heart, and it can wreak havoc upon us. A major problem with Lp(a) is that it is very, very prevalent. So we typically say 20% of the population has elevated Lp(a). That's the Caucasian population. The Black population, it's 30%, and South Asians, it's about 25%. So those are huge numbers. And the interesting thing also for me is that we choose to define elevation by being greater than 125 nanomoles per liter. Whereas if you look at any lab test for Lp(a), 75 is the upper limits of normal. So probably that 20% or 25 or 30% is an underestimation, even though it's a big number, an underestimation of how many people are actually at risk because of Lp(a) elevation.
So it sounds like it's really common. I mean, 1 out of every 5 in our country, but all over the world. And as you said, certain populations that have a greater chance of having an elevated Lp(a). So why should we not only be aware, but maybe be proactive about asking our doctor, our clinician, our clinical team to test our Lp(a), because unfortunately, because it is this triple threat and it is so common, paradoxically, we're well aware that most people don't know their Lp(a) level, and the majority of clinicians are not testing Lp(a). So what can we together do about this to bridge these gaps?
Yeah, so it's an important and interesting question. And we, at the Family Heart Foundation have data from the Family Heart database, which is a huge database, currently about 340 million individuals in that database, where we've up till about 2021 through 2021, we found that only about 1.1% of the population had Lp(a) tested. So why is that? It's so such a high risk state. Wouldn't everybody want to know what his or her Lp(a) is? And the answer is yes, everybody should want to know. But there's been a lot of clinical inertia, I would say, mostly because physicians say, well, there's nothing we can really do about it yet. Yes, there are drugs in development, but what are we going to do? We're just going to, worry the patient if we see a high Lp(a). That's not true, though. first of all, we do actually have a therapy, which is lipoprotein apheresis, something you and I, have both done, and it is an approved therapy for Lp(a). So there is something right now. But beyond that, just knowing if one has elevated Lp(a), individuals can be much more aggressive with reducing other cardiovascular risk factors. They can exercise more. They can lower their LDLs even further. They can maintain an optimal weight better. They can test their family members to see if there's risk. And they can understand why perhaps they've had coronary disease at an early age. So there are a lot of reasons why it's good to know. And in my view, personally, it's always better to know than not to know, even if you don't have something that you can actively do about it.
There are other countries that in their guidelines, the Canadian Cardiovascular Society, the European Society of Cardiology, they actually recommend that all adults should have an Lp(a) tested once in their life. We're waiting now for the updated cholesterol guidelines in this country. But let's just say we should all get our Lp(a) tested once in our life. How do you get an Lp(a) test? Is that something simple to do? Is it part of the traditional cholesterol panel, or how do we make sure we're getting the right test from our doctor?
Well, there are a couple of different ways to do it. You can do it through the Family Heart Foundation. We have a program called Cholesterol Connect, and it's a free test of LDL and Lp(a). So that's a great way to do it. You can go on the Family Heart Foundation's website to access that. But you can also do it in your physician's office. It's an easy blood test. It's not expensive, although some people claim it is. It really is not a very expensive test. It's easily accessible. So I would say everybody should run out and get an Lp(a) tested. I would say one other thing, though, that although some of the guidelines, the European, Canadian guidelines talk about once in a lifetime testing, I'm actually an advocate potentially of more than once in a lifetime for certain populations in particular. Women, for example, can have a very, very substantial increase in Lp(a) levels at the time of menopause. So, having it done once, is a heck of a lot better than never having had it done, but it might be worth repeating, frankly, in everybody, because sometimes tests can be wrong as well. And, you do a second test, you go, oh my, that's very different from, the first test, because a lab error that can, occasionally occur. So I wouldn't limit ourselves to a single test in a lifetime.
I think it's important for the listeners today, though, to recognize that getting Lp(a) tested is a separate test from the cholesterol profile that their doctor usually would order for them. And so it's important that they ask to have an Lp(a) test specifically. And you make a good point that awareness is important. This is Lp(a) Awareness Day. On behalf of the Family Heart Foundation, Lp(a) it's a genetically determined factor for the most part. So let's just say somebody finds out their Lp(a) is elevated. Why is it important for them to know and their family to know?
Yeah, so it's a wonderful opportunity to understand one's personal risk for cardiovascular disease. And then if that risk is elevated on the basis of Lp(a), then other family members, starting with first-degree relatives, should be tested as well. Because as you point out, it is a genetic disorder. So you will find other people in the family with similarly elevated risk. I'd also just want to emphasize something you just mentioned about advocating for yourself, asking your doctor for it. It is a different test from a standard lipid profile. Sometimes doctors might push back for a moment and go, there's nothing we can do about it. You sure you want to test it? I would encourage everyone to advocate for yourself. It's not in a contentious fashion. It's just, hey, this is important to me. This is important to my family. Please, I'd really like to know. So I would do that in this case.
Yeah, I find that it is really important additional information as we think about somebody's cardiac risk. And not uncommonly, we might find an elevated Lp(a) in a family where there's been a lot of early heart disease without explanation. And, it certainly gives us part of that answer, number one. It also provides information for other families members to be much more aware of an accelerated risk, to be proactive and hopefully preemptive in preventing events like family members have had in the past. That Lp(a) being elevated, though, I truly think we are at a pivotal time in terms of translating science to clinical practice, not only being able to measure Lp(a), but we're really on the horizon potentially, kind of partial pun intended here, of Lp(a) specific therapies. Pretty incredible. And this has taken decades of understanding, some exciting pharmacologic techniques to be able to powerfully lower Lp(a), and it appears so far safely, as much as 80 or 90%. So what can you share about what's happening really like real time right now, but how do we think about the next year, a couple of years in front of us, about some of the evidence and data we're awaiting?
Yeah, so it is an incredibly exciting time. We have a number of drugs in development, and more, frankly, more appearing almost, on a regular basis. I wouldn't say, I was going to say daily. It's not really daily. That would have been hyperbole. But on a regular basis, we have more and more drugs entering development. Um, I would say next year, yeah, the first of these large clinical trials, these cardiovascular outcomes trials, will read out, and we're gonna have some very, very exciting data, I believe. I would say also that because we are on the precipice of such a monumental change, having therapeutics, hopefully, for Lp(a), more reason for everybody to get tested now. You want to know your risk if it is on the basis of Lp(a), to be in a position when medications become available to be able to access them, and to also to have our physicians educated and aware about Lp(a) and the importance, if and when we get therapeutics, to treat Lp(a). We've fallen short with LDL. We're not treating as many patients as well as we should be treating them with elevated LDL. People after heart attacks still have LDL that's too high, and we can't make the same mistake with Lp(a). This is a tremendous opportunity for us as clinicians and as patients and as payers, as policymakers, to make an enormous shift and get this right from the outset and treat the right patients at the right time. So this Awareness Day, Lp(a) Awareness Day, is extraordinarily important to be able to convey that and spread the word about such an important cardiovascular risk factor.
Well, we have been partners on this conversation today. What can we do to help convey some of the resources and commitment of the Family Heart Foundation for our listeners to not only be aware of Lp(a), but be able to test their Lp(a)? You mentioned Cholesterol Connect. What are some of the other resources in terms of Family Heart Foundation if somebody finds out they have an elevated Lp(a), to be able to learn more about that?
Well, we have live people who can answer questions, live trained people. So you can go on the website and actually end up speaking to somebody who has knowledge about Lp(a). You can be directed to clinicians who have expertise in Lp(a), who can help manage the situation, help navigate the screening of the family if you are going to go down that road, which is always a good road to go down. And we're also, doing our own studies, quite frankly, to be able to understand better how Lp(a) manifests across the United States in our very robust database. We do a lot of publishing, and you've been part of that and led a lot of that, Larry. So there's a lot going on in the foundation that patients and clinicians can become involved in. I would say go to the website, look at all the resources, look at the data that we've published, become involved and an active participant along with us.
Well, thank you so much, Dr. Baum, for this incredible information on Lp(a). It is Lp(a) Awareness Day today, all day, and for the rest of the month, by the way. But really beyond each and every day is an opportunity for us to better understand Lp(a) as a potent cardiovascular risk factor. We should all be aware of our Lp(a) levels. And if they are elevated, we want to seek appropriate care and counsel because there are things we can do to reduce our cardiovascular risk. So if our listeners would like to join us and learn more about this, you can visit lp(a)awarenessday.org to find additional resources and a toolkit. And then, of course, always lots of information at the Family Heart website. So, Dr. Baum, thank you again so much for joining us today.
Thank you. It was a pleasure.